President Joe Biden has been twice vaccinated, twice boosted, but recently announced he has tested positive for COVID.
Hey folks, guess you heard this morning I tested positive for COVID. But I've been double vaccinated, double boosted. Symptoms are mild, and I really appreciate your inquiries and your concerns. But I'm doing well. I'm getting a lot of work done. I'm going to continue to get it done. And in the meantime, thanks for your concern, and keep the faith. It's going to be okay.
We'll get back to his COVID positive test in just a second, but just yesterday he said he had, present tense, has cancer.
And guess what? The first frost, you know what was happening? You had to put on your windshield wipers to get literally the oil slick off the window. That's why I and so damn many other people I grew up have cancer, and why can't for the longest time Delaware had the highest cancer rate in the nation.
Now, after he says this, the White House very quick put out a statement and said, well, no, he doesn't mean he has cancer. He meant that he had melanoma, skin cancer. It was removed before he became president. So he doesn't currently have cancer. But he said he has cancer, present tense, just then. But they did a cleanup on aisle number 6. Now, regarding his COVID positive test, don't know when he contracted it. Don't know where he contracted it. Don't know really how long he's had it. We do know that a camera person filmed him. And was that camera person 6 feet away when the camera person filmed this video of Joe Biden saying he has COVID-19? It also tells you that you can be boosted, double boosted, tri-boosted, triple boosted, and still contract COVID. Dr. Fauci's had it, I think, twice. And he's about the same age as Joe Biden, if not a little bit older. Now, maybe that explains why he fist bumped that Saudi premier prince king when he met him. Remember when he did that? Jimmy Fallon, please.
Let's get to some news. On Friday, President Biden held a controversial meeting with the Crown Prince of Saudi Arabia. But the real controversy was that Biden greeted him with a fist bump. Watch this, watch this. Yeah. Biden said that wasn't a fist bump. That was me trying to punch him as hard as I could.
Now, I'm not at all saying that the White House is lying. Lord knows Joe Biden wouldn't lie, even though he lied about having met Nelson Mandela, even though he lied about his civil rights record, even though he's plagiarized speeches in the past. Lord knows that the White House wouldn't lie about whether or not he might have had symptoms at the time, which might explain why the fist bump. All we know is that he used a fist bump. Seemed awfully odd. Now, this raises a lot of questions, though, about COVID. We haven't talked about COVID in a while in the program. New study done in Japan found out face masks become disgusting bacteria traps as mandates continue. And they evaluated 3 types of face masks that are commercially available in Japan: non-woven, polyurethane, gauze, or cloth masks. And they captured cultured bacteria and fungi from both sides of the mask worn by 109 medical school volunteers. 99% of the samples had bacterial colonies growing inside the mask. 94% had it on the outside. Fungi, 79% of the samples had it on the inside, 95% on the outside. And as far as duration, study found there's a correlation between an increased risk of fungi growth and the longer you wore the mask. Now, the conclusion by these Japanese researchers is as follows. Immunocompromised people should avoid repeat use of masks to prevent microbial infection. In other words, if you are compromised, you're not supposed to use your mask more than once. People use their mask all the time. And based on these findings, there is zero evidence the mask worked against even less contagious variants. Zero evidence. Now, there's a study out here in LA County that the CDC relied on for the school mask mandates. Turns out it was authored by the LA County Public Health Director's daughter, who is also not an MD. The study found that the COVID mitigation efforts, including forced masking, were highly effective in stopping the disease spread. Cited by CDC, cited by a whole bunch of news outlets. Turns out that the woman who helped to author the study is not a medical doctor, doesn't have a science background, doesn't have a PhD in any field. Her professional background is a combination of urban planning and community organizing. And she co-authored the study. Was hired by the LA County Office of Education in late 2020 as a temporary project manager and PR and communications department. Also did a few political campaigns for her mom and for the Boston mayor, Thomas Menino. She is well qualified. She's probably as well qualified for that job as Mayor Pete is for the job as Secretary of Transportation. But I digress. Another study. Do mask mandates work? We talked about this a few days ago. Turns out that because of an uptick in COVID-19 cases, Alameda County was the only Bay Area county to bring back the mask mandate indoors. At the time, the county health officer, Dr. Nicholas Moss, said, quote, putting our mask back on gives us the best opportunity to limit the impact of a prolonged wave on our communities. Now, since that was the only county in the Bay Area that brought back the mask mandate, they gave us an ideal laboratory to find out whether or not there's going to be any difference in infection rates when you compare them to the adjacent counties, Contra Costa and Santa Clara. And it turns out no difference in infection rates, none, which suggests that the mask mandates, despite the study that was co-authored by the daughter of the health county official, daughter not an MD, despite that study, it turns out the mask mandates didn't work. One of the reasons is that people don't wear them properly. They don't use N95 because it's so uncomfortable. The cloth mask and the gauze mask don't do anything at all. So it turns out the mask mandates are not effective, at least according to this Bay Area study. They gave you an ideal case. Again, one county, Alameda, brought it back. Counties on either side did not. No difference in infection rates. This ought to be disturbing. Health experts are quitting the CDC and the NIH due to, quote, bad science, according to Dr. Marty McCary. He's a professor at Johns Hopkins. And Johns Hopkins is still accredited as far as I know. He says that low morale fostered by bad science and frustrated experts causing people at the NIH, the National Institutes of Health, and the CDC and the FDA to quit, creating serious staffing shortages. The leadership of the agencies is being questioned. The Pfizer trial data found no really big difference that the shots provided for young children, yet they approved them anyway. A lot of people did not think that was good and have resigned. FDA vaccine panels have expressed concern about the lack of safety data for the children. Dr. McCary, writing for the Substack page called Common Sense, so you don't get canceled on the social media platforms, said other decisions by the NIH, by the CDC, by the FDA have hurt morale among employees, including support for the masking mandates in schools and the closing of the schools during the pandemic. One FDA official said this, and I'm quoting, "It's like a horror movie I'm being forced to watch, and I can't close my eyes. People are getting bad advice, and we can't say anything." One NIH scientist spoke on the condition of anonymity, said, quote, "There is no leadership right now. Suddenly, there's an enormous number of jobs opening up at the highest level positions," end of quote. A CDC scientist told Common Sense, also on the condition of anonymity, I wonder why nobody wants to give his or her name, that the agency, quote, "failed to balance the risk of COVID with other risks that come from closing schools. Learning loss, mental health exacerbations were obvious early on, and those worsened as the guidance insisted on keeping schools virtual. CDC guidance worsened racial equity for generations to come. It failed this generation of children," end of quote. What they mean is that black and brown students were already behind. Now they're behind another year or two. I mentioned I think it was yesterday, 85% of black 8th graders are neither math nor reading proficient. 85%. And the majority of them, almost all of them, are in government schools, and these are the ones that were shut down.